Hi friends, this is Dr. Anugraha here. So today's topic is muscles of mastication. What do you mean by mastication, guys? Mastication is nothing but the act of chewing food, right? Eating food, that is mastication. Now let's read the question first and then we'll come back to it once I explain to you the muscles of mastication. So Ramu's jaw got locked while yawning. So Ramu, he was yawning, and what happened during that time? His jaw got locked. He couldn't open it further or close it. Okay. So the question is, which muscle attached to the articular disc of temporomandibular joint is responsible for this condition? Now the options given are, see guys, masseter, temporalis, lateral pterygoid, medial pterygoid. Let's start with muscles of mastication. So whatever options they are given, all these are nothing but they are the muscles of mastication. These muscles help you to chew food. These muscles help you to talk, to move your jaw, right? Now one by one we will learn. First is, okay, so see this muscle that you see here, let's take the first picture. Can you see this muscle here? This is a lateral view, okay? Laterally I'm seeing the skull. So this muscle that you see is your temporalis because it's in the temporal region, right? Now, see again, see this picture. Again, this is a lateral view. See on both sides in the temporal area we have got which muscle, guys? Temporalis. See again, this is temporalis. Now, this temporalis, you know from where it starts? It starts from the temporal fossa. Okay, there is a depression here. That is the temporal fossa. It starts from there and it gets inserted where, guys? Into the mandible. You all know the mandible now. This is the mandible. Now, a little bit about the parts of the mandible. Okay, look here. Look here. This is the mandible. See, this part here, can you see two projections? Okay, so this projection is called as, okay, so this projection here, this is called as coronoid process. What is it, guys? Coronoid process. Okay, so this part, say both sides, this projection is called as coronoid process. And this projection that you see here, that is called as, very good, condylar process. What is it? Condylar process. Again, see this picture. Okay, this is the mandible side view. Okay, you can see two processes, two projections. This is the coronoid process that you see here. And this is a condylar process. And then the other part of the mandible, this green area that you see, this part, guys, that is called as the ramus. What is it? Ramus of the mandible. And then this part that you see, okay, this part, that is a, very good, body of the mandible. This much clear? So can you tell me what are the parts, main parts of mandible? Yes, we have the coronoid process, right? And then above we have the, here, see this picture. This part, that is a condylar process. This part is the ramus. And then we have the body of the mandible. This much clear. Now, why did I teach about mandible? That is to tell you that this, one second, I think it's taking some time to come. So this temporalis muscle, it starts from where, guys? Where is the origin? It starts from the temporal fossa and it ends where? In the mandible. Where is it inserted in the mandible? It is inserted to the ramus. Okay, it is inserted to the ramus and condylar process of the mandible, right? It is inserted to the, see this part is a ramus. Okay, this part is a ramus and this part is a condylar process. So to these parts of the mandible, this muscle gets inserted. This much you understood. Now look here, guys. I'll draw two bones here. 1 second. Okay, now see I have drawn two bones, okay, just two random bones, and then I am drawing one muscle like this, okay, one muscle connecting these two bones. I am telling you this is bone number 1, this is bone number 2. Now I am telling you bone number 1 is the origin of that muscle, origin, okay, the muscle starts from there and this muscle is inserted into bone number 2. Okay, this is, I am telling you this. Now, when this muscle is contracting, what happens? The length of the muscle becomes less. See, suppose this is a muscle. When I say it is contracting, the length becomes less, right? Now, when the muscle is contracting, what happens? Now, where does the movement occur? Will the bone 1 move or will bone 2 move? Remember, whenever a muscle is contracting, guys, it will pull towards itself the bone which is to which it has inserted. Whenever a muscle is contracting, it will pull towards it, whichever direction the contraction is occurring, it will pull towards it the bone. Which bone? The bone that it is inserted into. So if this muscle, that black color that is contracting, what happens to the second bone, this bone here? What happens? 1 second. Yeah, the second bone here, this will move towards this muscle. Understood? See, once again. Suppose let us say there is a muscle here, right? We have a muscle here. It starts from here, it ends here. Okay. Now when this muscle is contracting, okay, the muscle is becoming small, short. When this muscle is contracting, I told you muscle is originating here, muscle is getting inserted here in this bone. Now when this muscle is contracting, it will pull towards itself the bone to which it is inserted. So what happens? This bone moves up. Understood? This concept understood? Okay. Now, why did I tell you that is? See, remember this temporalis bone is inserted to the mandible. Now remember, when this temporalis muscle is inserted to the mandible. Now when this muscle is contracting, it will cause the movement of the mandible. It will cause the movement of the mandible. Now to which direction? That we will learn. So remember, okay, I'll show in this picture. This temporalis muscle, guys, it has got vertical fibers. Let me take black color. Yeah. So this temporalis muscle, it has got 3 kinds of fibers. It has 3 kinds of fibers. See, if it gets little too much on the brain, I'm very happy to sing. But then there was one student who told that don't sing. But music gives peace to the mind. So whenever I feel like singing, I'm gonna sing. Okay, please excuse me. So guys, see this temporalis muscle. It has got 3 kinds of fibers. It has vertical fibers. It has oblique fibers, matlab slanting fibers, and then it has posterior fibers, meaning fibers which go posteriorly, right? Posterior part of the head. So temporalis muscle has got 3 kinds of fibers, muscle fibers. Now, when this muscle is contracting, listen carefully. When this muscle is contracting, this anterior fibers, that is this vertical fibers, okay, and these oblique fibers, when these fibers are contracting, it will cause the elevation of the jaw. It will pull the mandible up. Because see, when these muscles, when they are contracting, they are becoming short. I told you it will pull along with it the bone to which it gets inserted to. So it will pull the mandible up. So that action is called as what, guys? Elevation. So the action of temporalis, first action, remember it is elevation of the jaw. And this posterior muscle that you have here, this posterior muscle, see, it's going backward. Okay. So now when this posterior fibers, or the posterior fibers of temporalis muscle, when that contract, what happens is it will pull the mandible backwards, like, okay, that backward movement of the mandible, and that is called as retraction. Guys, you know what is the difference between protraction, retraction? Protraction means like like this. Okay, I move my jaw in front, that is protraction. Retraction means if I move the lower jaw behind, that is retraction. Okay, so this way you see the posterior fibers, okay, when they contract, what happens? It will, yeah, pull the jaw back. Okay, so this causes a retraction of the jaw. Let me show. Okay, see, can you see this is protraction, right? Anterior movement of the jaw, and this is retraction, posterior movement of the jaw. So the temporalis works on, yeah, a retraction. So and tell me again, temporalis muscle, the anterior and the middle fibers of the temporalis muscle, they cause what, guys? They cause elevation of the jaw. Very good. And posterior fibers, they cause the, very good, retraction of the jaw. See, anatomy is very simple, no? See, during my first year MBBS, okay, anatomy was one of, anatomy was the toughest subjects. And I can say that of course I passed in the first attempt itself, but it was very difficult. Okay, by the grace of my teachers, maybe I can say I passed above average. See, I understood anatomy after, I went to coaching classes. Okay, that's when I understood, okay, this is how our body works. Yeah, fine. So we learned about temporalis muscle. Let's move on to the next muscle, which is the strongest muscle of the body, that is nothing but masseter. Now see here, guys, this is a lateral view, side view of the skull. You can see this muscle here, that is nothing but the masseter. What is it? Masseter. It is the strongest muscle of the body. Now, where does it start from? Where does it get inserted? See, it starts from the zygomatic arch and it gets inserted where, it gets inserted to the ramus of the mandible. Okay, to the mandible. You can just remember that. So, once again, look here, look at this picture. Okay, this is a zygomatic arch. So, this muscle, masseter, starts from the zygomatic arch and it inserts where, guys? Into the ramus of the mandible. Again, look here, this muscle that you see, yeah, this part. See, you just talk, you keep your fingers on your face like this and talk. You can feel that muscle. Yeah, so that is your masseter. Now remember, this masseter has got superficial fibers, superficial muscle fibers, and deep muscle fibers. So look here, this picture carefully. Okay, this is a superficial fiber, and this part that you see inside, that is a deep fiber. Okay, now there was one question where they asked masseter which kind of muscle fibers it has got. Okay, we have got different types of muscle fibers. We have pennate, we have got parallel, we have got cruciate. So different kinds. We'll talk twisted and all that. We'll talk about it later when I teach you the types of muscle fibers. So remember, okay, here there are two kinds of fibers. I said there is deep muscle fiber, and there was what? Superficial muscle fibers. So when these fibers cross each other, when two muscle fibers cross each other, then such muscle fibers are called as cruciate muscle fibers. What is it, guys? Cruciate muscle fibers. So masseter has got what kind of muscle fibers? Cruciate. This has come as a question. Okay. Now masseter, what is the function of masseter? See, when this muscle contracts, okay, when this muscle is contracting, here is the masseter. So now when this is contracting, what it does now, I told you it gets inserted where? To the mandible. So when this muscle is contracting, it will pull the mandible up like this. So it will close the mandible. So what is the function of masseter? You tell me. It is a closure of the jaw. It is a closure of the jaw. Now guys, let's move on to lateral pterygoid and medial pterygoid. See, again, this is the lateral side, lateral view of the skull. You can see this part is called as a temporomandibular joint. Okay, here we have the temporomandibular joint. Let's come to that. So, okay, Now here you can see this muscle, okay? So these two that I have drawn, see this, though it looks like two muscles, it is one muscle that is nothing but your lateral pterygoid. I don't know why it's taking time, there's some lag. Yeah. So this that I have drawn here, look here guys, these two, though it looks like two muscles, actually one muscle, it is nothing but your lateral pterygoid. Lateral pterygoid has got upper head, this is the upper head, okay, and this is the lower head, okay. So once again, this is your lateral pterygoid, okay, this is your upper head of the lateral pterygoid, and this is the lower head of the lateral pterygoid. Now the examiners like to ask questions from lateral pterygoid, so yeah, just remember this muscle, okay. Now you can see another muscle, see, I'll just draw it for you, see this part, okay. This also looks like, two muscles, but actually this whole thing that I've drawn, that is your medial pterygoid. What is it guys? Medial pterygoid. Now medial pterygoid has got, see, this is the superficial muscle fibers. I'll take a different color, see. This is the superficial muscle fibers of medial pterygoid, and this part, that is the deep fibers of medial pterygoid. See this part, that is the deep fibers of medial pterygoid. Repeat after me, what is medial pterygoid? See the whole thing that I am drawing here with black, that is a medial pterygoid. It has got two types of fibers, that is, yeah, superficial fiber, superficial muscle fiber, this one, and inside you can see now, that is the deep muscle fiber. So that's your medial pterygoid. Again, see this picture. Now you tell me, what is lateral pterygoid, what is medial pterygoid? See, one that is up, okay, this part, this is your lateral pterygoid, okay. Now this lateral pterygoid, this is the upper head, this is the lower head, okay, very good. Now see, just remember one point, you can see the lateral pterygoid, yeah, it is in very close contact with the temporomandibular joint. Keep this point in your head, we'll come to that, okay. Now see the lower muscle, this is your medial pterygoid. We have got the we have the superficial fibers, and inside that is the deep fibers. This much understood. Okay. Now, what is the function of lateral pterygoid? See, no? See, I have drawn in red. This is lateral pterygoid. What is the function? You will remember with the mnemonic. Yeah, with the mnemonic DSP. What is it? DSP. That mnemonic you will remember for lateral pterygoid. Now, see, so we are learning the functions of lateral pterygoid. D stands for depressor. See, it is a depressor of the jaw. Very important. This has come in multiple exams. Which is the only depressor in the mastication muscles? That is your lateral pterygoid. Please don't forget it. S is what, guys? S stands for, side to side movement. Like this. That one, okay? So that is your side to side movement. See, actually for side to side movement, you need lateral pterygoid of one side and medial pterygoid of opposite side. When they both coordinate, you get the side to side movement. So yeah, remember, that is another function of lateral pterygoid. P is for protraction, okay? Protraction, like this. This is protraction. So that also is done by lateral pterygoid. So you remember the code DSP. Alright. Okay, moving on to medial pterygoid. Here you will, okay, where is our medial pterygoid, guys? Look at this picture. See, this both lateral pterygoid, medial pterygoid. No, it's like inside your mouth, okay? The temporalis masseter and all we can feel, but both these medial pterygoid, lateral pterygoid, they are inside, okay? So it's difficult to feel even actually. Okay, so medial pterygoid, see this one that you see here, that is your medial pterygoid. And what is the function of medial pterygoid? You will remember the code EPS, okay? E stands for elevation, P P stands for protraction. S stands for side to side movement. So EPS is a code that you will remember for medial pterygoid. They mostly, they like to ask about lateral pterygoid. So at least remember lateral pterygoid. Now, okay, nerve supply of all these muscles. What all we learned? We learned temporalis, we learned medial and lateral pterygoid, masseter. So your sir asks you, what is the nerve supply of all these muscles? You'll just give one answer. That is your mandibular nerve. What is it, guys? Mandibular nerve supplies all of these muscles. See, in embryology, we have to learn about pharyngeal arches. Okay, so these structures here arise from an apparatus called as pharyngeal apparatus. Now, in pharyngeal apparatus, we have got arches. Okay, so 1, 2, and so on. In embryology classes, I have put up embryology classes. If time permits, go through that. Otherwise, just remember that these structures from this area, they arise from something called as pharyngeal apparatus. In that, we have got arches. Okay, we've got arches like this, and the first arch, okay, that is called the first pharyngeal arch. From there, these muscles arise. These muscles originate. Now, all the structures, that come from the first pharyngeal arch, they all are supplied by mandibular nerve. So, if you didn't understand in this embryology part, leave it. All the mastication muscles are supplied by mandibular nerve. Okay, so mandibular nerve is what? It is a division of which nerve? It is a division of the fifth nerve. Fifth cranial nerve is what, guys? Fifth cranial nerve is? Very good. Trigeminal nerve. Okay, so in the comment section you will write, okay, don't write all the 12 cranial nerves. Just write at least the first 2 cranial nerves. Okay, what do you call the first cranial nerve? What do you call the second cranial nerve? You please write it down in the comment section. Okay. So yeah, the fifth cranial nerve is what, guys? It is trigeminal nerve. Now this trigeminal nerve, okay, it originates from the brain, and then what it does? Okay. It divides into 3 branches. We have got the ophthalmic division, maxillary division, mandibular division. Okay, yeah. So this mandibular division or this mandibular nerve, this nerve supplies your mastication muscles. So please don't forget, all the muscles of mastication supplied by mandibular nerve. Oh, I have written the trigeminal nerve here. See, this trigeminal nerve, okay, it originates from the brain, and then what? Yeah. It divides into 3. Look here. Okay, this trigeminal nerve, it divides into 3 branches. This is your ophthalmic branch. We call it as V1. This is the maxillary branch, V2. And this is your mandibular branch. Okay, so and this area, see red color, those areas are supplied by the ophthalmic nerve. The yellow color, this part, yellow color, they are supplied by the maxillary nerve, and this dark yellow color, this part, that is supplied by the mandibular nerve. Okay, so again this picture, same thing it shows, right? Yeah, the trigeminal nerve, it divides into ophthalmic nerve, which supplies this area, right? And then it divides into maxillary nerve, which supplies this area, and then it divides into mandibular nerve, which supplies this area. Okay. Now, see a little bit about the temporomandibular joint. See guys, look at this skull here. Okay. You know that this is a temporal bone, na? You know that is a temporal bone. Okay. And you know that this is the mandible. That also you know. Okay. Now, between the temporal bone and the mandible, this part, okay, this part here, that is called as a temporomandibular joint. Temporomandibular joint. Now, if I enlarge this temporomandibular joint, see this picture here. In that temporomandibular joint, what are the parts? Okay, see the upper part is definitely the temporal bone, right? And below, see I told you mandible has got 2 processes, right? Okay, so this is a condylar process. Okay, so above part is the temporal bone, below is the condylar process of the mandible, and in between, see guys, in between, can you see this blue color area that I am drawing, that area is called as the articular surface of temporomandibular joint. Articular surface मतलब क्या है? You know that fibrocartilaginous part of that temporomandibular joint. Now tell me, okay, let's come back to that. Wait, tell me, why do we need, this articular surface in this joint? See, this articular surface, this blue color that I have drawn, that gives a cushion effect. Okay, it allows the mandible to easily slide over this part. We can talk easily, chew easily, clench easily. Suppose, okay, there was no articular cartilage here, there was no articular surface here. Okay, the temporal bone was directly connected to the condyle of the mandible. If it was like that, see guys, whenever we chew or talk, there is going to be constant rubbing of this mandibular bone, okay, the condylar process of the mandibular bone with the temporal bone. So there's going to be constant friction, wear and tear, and there's going to be difficulty in speaking, chewing. But if there is a articular surface in between them, it gives a cushion effect, it gives more stability, and it also allows easy movement of the jaw, right? Because there is an articular surface there. Now you understood the importance of that articular surface in the temporomandibular joint, right? Once again, this is a temporomandibular joint enlarged. The upper part is a temporal bone. The upper part that I have drawn is a temporal bone, and below it is a condylar process of the mandible. In between whatever you see, this is the articular surface of that joint. Okay. Now, see, look here, guys. Look here. Again, this is a lateral view. Lateral view. I'm looking from the side. This is a temporomandibular joint. Okay, this part that I'm drawing is a temporal bone, right? This is the mandibular bone, the condylar process, and in between whatever you can see in white, that is the articular surface. Now in BD Chauresia, it's clearly mentioned that, guys, see, tell me which muscle is this that I've drawn in green. This. What is it? It is lateral pterygoid. Am I right? It is lateral pterygoid. Okay. Now, in our textbooks, it's clearly mentioned that this articular surface of the temporomandibular joint is nothing but the degenerated fibers of lateral pterygoid. Let me tell that again. This articular surface that you see here is nothing but the degenerated part of this muscle, lateral pterygoid. Okay. Now, whenever let's say that when the person is yawning, okay, or whenever there is excessive tension in this muscle, what happens is this muscle can slightly dislodge this muscle. One second. This muscle can, whenever there is excessive tension in this muscle, suppose the person is yawning and there is more of pressure in this muscle can dislodge this articular surface from this area. So this surface, okay, this articular surface can get slightly dislodged when there is more tension in this lateral pterygoid, like yawning. If it's excessive yawning, it can slightly dislodge this articular area, articular surface or articular disc. And this dislodged part, because of this dislodgement, what happens? The movement of the jaw gets compromised. Yeah, I kept getting messages from an app. So yeah, where are we? So yeah, when this articular disc gets dislodged, what happens? The movement of the jaw can get compromised, and this results in something called as lock jaw. Understood? Where the patient will not be able to completely open or close the jaw. It gets stuck like this because this part has got dislodged. Only if this part is normal, this movement of the mandible can take place well. Okay. Now let's go back to the question. See here, the question was, this Ramu has got lockjaw. They asked which muscle is responsible for causing this condition. Now tell me the answer. The articular disc is nothing but the degenerated part of the lateral pterygoid. And now when there is more tension in this muscle, it can sometimes dislodge that articular disc, and this causes problem with the jaw movement. So your answer is lateral pterygoid, guys. Okay. So yeah, where is my last message? Stay positive, be happy, and give me the feedback. Stay healthy, drink lots of water, and yeah, take care. Bye bye. See you next class. Bye.